I'm Sandy Barua with the Detroit Regional Chamber, and on behalf of the Chamber and Detroit Public Television, I'm delighted you are able to join us for this MPC moment. Under normal circumstances, Michigan's business, civic, and elected leadership, along with media outlets from across the state and across the nation, would be convening for the annual Mackinac Policy Conference at the historic Grand Hotel for a conversation about the direction of our state. These are anything but normal times. To celebrate what would have been Mackinac Week, DPTV and the Chamber have partnered yet again to bring you a series of MPC moments, 3 days of looking back at important conversations from prior year conferences and putting them in the context of today's extraordinary circumstances. So please welcome my friend, the host of Detroit Today on WDET, contributor to DPTV and One Detroit, as well as a Mackinac Policy Conference contributor, my friend, Stephen Henderson.
Sandy, thanks very much for having me here, and thanks very much for putting this together for those of us who are having a little bit of a Mackinac Jones this year because we're not up on the island. I'm really happy to host today's conversation, which is going to look back on some of the top sessions from the Detroit Regional Chamber Mackinac Policy Conference over the years. And I have some really great guests joining me to talk about what we need to do now to move Michigan forward. So let's get started. With everything that's going on now, public health and safety are, of course, the things that are on the top of all of our minds. And unfortunately, Michigan is not new to dealing with things like aging infrastructure or public health crises. We saw that just last week with the dam failures in Midland and the chaos that it has caused in that region. In 2016, Dr. Hanna-Attisha addressed the Mackinac audience to talk about the devastation of the Flint water crisis and shared her vision for Flint and all of Michigan.
10 parts per billion is the World Health Organization's action level for lead in water. That's when you need to do something. 15 is the Environmental Protection Agency's action level for lead in water. Both levels too high now that we know that science has taught us there's no safe level of lead in a child. And just a few weeks ago in Flint, we had a home with a lead level in their drinking water of 22,905. 22,905 parts per billion. That far exceeds those action levels. That far exceeds the toxic level of lead in water. And it's difficult to comprehend that in 2016, in the United States of America, that we have homes with toxic levels of lead in their water. You can think of it like a straw, like drinking through a lead-painted straw. And you never know when a piece of lead is going to come off of our severely corroded pipes and fall into our drinking water. For over 2 years, the people of Flint have been drinking through lead-painted straws. Our children have been drinking through lead-painted straws. How did we get at 22,905 in a city that is literally in the middle of the Great Lakes? We know Michigan. In a city that is in the middle of the largest source of fresh water in the world. How did we get at 22,905 in a city that helped build America? And in 2011, we were under state-appointed emergency management, and they decided that the water we had been getting from Detroit for half a century, fresh, pre-treated Great Lakes water, was too expensive. And with a simple flip of a switch, an actual flip of a switch, we started drawing water from the Flint River. And it didn't seem right. And the heroic people of Flint, they raised their voices, and they've never stopped raising their voices. And when we proved that lead was increasingly in the bodies of our children, we knew that our focus had to be on their tomorrows. we are trying to wrap our children around with every evidence-based intervention to promote their development and to mitigate the impact of this exposure. Because the treatment for lead is the same treatment that builds healthy children and strong communities. It's early intervention and universal preschool and school health services and nutrition and behavioral health care and going to your doctor. The treatment is investing in children, especially our youngest and our most vulnerable. And in 5 years, 10 years, 20 years, when you think about Flint, you may still think of Flint as a city that built cars, or the city with the contaminated water supply that needed the National Guard to deliver safe water. But what I hope you think about is our kids and how we were all able to invest and intervene for our kids, how we took a tragedy and we came together and we flipped the story, how we defied all odds, how we became a model for the nation.
Okay, joining me now is Wright Lassiter, who is President and CEO of Henry Ford Health Systems. Wright, welcome to the program.
Thank you, Stephen. Great to be here with you.
And also with us is Ridgway Wright, who is President and CEO of the CS Mott Foundation. Ridgway, welcome to the program.
Thanks for having me. Great to be here.
So, Wright, I'm going to start with you. We heard Dr. Hanna-Attisha talk in that clip about the devastation that the city of Flint experienced because of the Flint water crisis, but largely because of our lack of preparedness, our lack of readiness in terms of from an infrastructure standpoint, from a public health standpoint. Henry Ford has been at the absolute epicenter of the current public health crisis that we're experiencing in Southeast Michigan. I just want to give you a chance to talk about how prepared you think we were and what the front lines of that battle have looked like at Henry Ford.
Great, Stephen. And again, it's great to be with you, and thanks for the opportunity to chat a bit. I'm extremely proud of our organization, of our team members, of our nurses and physicians and frontline workers who have really had their shoulder to the wheel and to the grindstone, frankly, since early March when the first cases were identified in Michigan. And I would say that when you think about, you asked the question of how prepared were we, and talk about what it was like. Sort of start off with this. Normally health systems have a emergency operations plan that we are required to always have, and so we have this process called incident command centers. That when there is an emergency in an organization like ours, you stand up an incident command center. Our normal experience has been that happens at a single hospital. And so there is an issue in Community X, there's an issue in Macomb, there's an issue in Flint, there's an issue in West Bloomfield, there's an issue in Detroit. And so a single hospital stands up its incident command center, and that team rushes to bear arms to do what's necessary. And then oftentimes, frankly, throughout most of my career, 30 years in healthcare before this, if you're part of a system, then the rest of the system sort of braces itself for, okay, so how can we help our compadres in this part of the system to make sure that they have what's necessary? This was quite unique in that when we did, in second week of March, we stood up incident command centers at all of our hospitals because we were starting to get an influx of patients. What was unique was that we also stood up a system incident command center because every part of the community was impacted. If you recall early on, Oakland County in the early days of the COVID pandemic had more cases than Wayne County. And so it was a very different dynamic initially. Now, clearly Wayne County surpassed Oakland County, fairly early on. And so honestly, we had multiple times a day incident command centers that were having conversations with our emergency departments and understanding patient flow, having conversations with our inpatient units in terms of how do you bring patients on board. And that went on, honestly, until about a week ago, when we got to a place where we felt that we didn't need to have 7 days a week, multiple times a day, incident command check-ins across the entirety of our system. I would tell you that, so I think our team would say we felt very prepared to respond to what is a medical crisis. I think that anyone who's being honest would say what we weren't prepared for was a complete collapse of the supply chain system globally, to where there was such a scramble for personal protective equipment to ensure that your staff stay safe. And I can say that, we're a member of a large national group purchasing organization. Plus, we have direct relationships with suppliers. And so at no point in time, honestly, have I ever thought about supplies the way I have in the last 60 days. I mean, there was a period of time where I was having a conversation one day with members of the administration in Washington, the head of CMS, the supply chain leader for the administration, the lab testing leader for the administration, the undersecretary of Health and Human Services, and we were all talking about various parts of our supply chain and where we were having challenges being able to respond. For instance, we were fortunate to say that our system was the first system in Michigan to be approved by the FDA to begin doing COVID-19 testing. And so March 16, 6 days after the first case was declared here in Michigan, we were testing. But for the first month, we never had sufficient supplies and reagents to get to our full capacity. And so we were testing as much as we could based upon the supplies that were there. I would also tell you that you think about the toll that this crisis took on our staff. People have talked about COVID, in sort of a wartime vernacular, using wartime metaphors, and at times you might think that's overblown. But the reality is, when you think about the amount of effort that frontline caregivers had to give in the amount of shift work that they were having to do to manage volume. And at our peak, we had over 800 inpatients confirmed in our hospitals. And at that point in time, we had 150 to 200 more patients who were in isolation because they had the kind of clinical conditions that would suggest that they cannot come in contact with someone with a respiratory-borne illness. And so you imagine having well over 1,000 patients across our system that we treated were either confirmed COVID positive or we treated that way because of the kind of isolation that was necessary. It overwhelmed us, frankly. We have put in place, we've been very concerned about, frankly, PTSD and the stress that comes from caring for folks with such severe conditions. What some people don't realize is that when we all locked down our facilities from a visitation perspective, frankly, our caregiver staff became the extended family for many folks. And there were times where patients who were not going to make it would have one of our staff on the phone, holding a phone as they were saying goodbye to loved ones who couldn't be there because of the safety precautions. And so, while we think about how hard it was physically for folks, what we've been very focused on is the mental strain and how we can provide the kind of employee assistance support for our team members that would ensure that they could get through this crisis. And then the last thing I would say, Stephen, I could talk about this for a long time, but the last thing I would say is that the other thing that's been very challenging for our teams is that normally we don't experience death as frequently as we did during this crisis. I was just looking at our stats, and so we had just under 600 patients during this pandemic crisis who died in our hospitals. And when we think about the number of patients that our staff would normally see expire under their care, it's a much, much smaller number. I mean, we were seeing more die in a month than our teams would see in 6 months across the entirety of our system. And so to sort of think about not only the stress of the virus, all the unknowns around the virus, the worries about bringing the virus home to family and loved ones, but then the stress of having to play family member for dying patients, and then to watch so many patients expire under their care, put a significant burden on our team. And so I'm extremely ecstatic that we're at a place now where we have about 100 COVID patients across our entire system. And so we're far, far below where we were at the height of this, which was back in early April.
Yeah. I mean, it really is, just hearing you talk about it. It is like talking to someone who's experienced war or another large scale tragedy like that. Ridgway White, I have been really concerned about Flint in particular during this crisis. And it's because we just went through a tremendous crisis in the city of Flint with the water crisis and with the Legionnaires problem that followed that. And so you layer something like COVID on top of that. How prepared do you feel like we were in Flint to absorb yet another really serious health crisis?
Yeah, I mean, listening to Dr. Hanna-Attisha, it's always great to see, her passion there. And I think that the passion of the Mott Foundation and all the grantees that we work with, hasn't waned despite suffering multiple crises. And so, I think we just take that with us daily and look at the long-term picture, and we fight every day to ensure that that the suffering that's occurring from residents in Flint and across Michigan and the whole country and world, are lessened to the extent we can by support from the Mott Foundation. I know we've granted our emergency response around the water crisis was close to 100 million over 5 years, or actually has reached 100 million. For the COVID crisis, it's been about $2 million, but we're really looking at the long term. And our grantees, like the water crisis, they were the first responders here. But one thing I would look at is that the partnerships have been better. The partnerships with government hasn't failed at all levels, and they're starting to figure it out. And the hospitals, all the sectors coming together, I think, are going to get us through this hopefully better, but it is a challenge.
We've only got a few minutes left before we go on to our next panel, but I want each of you to talk about something that you see that's hopeful, something that says we've learned something, we're better prepared, we're more thoughtful about things going forward because of what's happened to us. Ridgway, I'll start with you.
Yeah, I mean, I think we've got to focus on building back better together, bringing together, as Sandy said in the introduction, all of the sectors, ensuring that we aren't siloed in our lanes. So you can have a tendency to have the business sector and the nonprofit sector and education all think separately about what's the best thing for their group. But if we can all bring our thought process together as a generalist of what's best for society, that's how we come out of this thing on top.
Before the crisis, Ridgway, how would you have graded the city of Flint and the state of Michigan in terms of making progress from the last crisis, the water crisis, to the point where the inequities that were on display then are not as maybe pronounced as they were?
Yeah, I mean, the inequities are huge, and we've got to focus on all of the factors that create health here: education, jobs, etc. I mean, Flint, there were 4 counties in the entire country that had job loss since 2008 as of last year, and Genesee County was one of them. So, we're still recovering from the financial crisis. We're still recovering from the water crisis, and we're gonna continue to do this. But the resilience is there, and the people are great, and we're ready to try to rise to this and at least lessen suffering, throughout this, and hopefully work better together.
So, Wright, you were talking about essentially getting to the other side of the curve, at least in this wave, at Henry Ford. I wonder what lessons you think we carry forward, particularly about the inequalities that, of course, have been on display at Henry Ford as well. I mean, in terms of who this is affecting and how.
So I make a couple of quick points. So on a hopeful and positive front, I would say that similar to what Ridgway indicated, community support of rallying together has been really amazing. We created several COVID relief funds and have been just amazed at the amount of support that we've received both from within our organization and outside the organization to support a number of things, from clinical trials and research, disparities research, et cetera, to support for our frontline workers. So I start with that from a positive note. I think that, to your point, Stephen, it shouldn't take a crisis, a public health crisis, to shine a new light on the fact that disadvantaged communities will always suffer disproportionately during situations like this, during public health crises. As Ridgway said, and as the physician stated in the video, the Flint water crisis clearly shone a light on that. COVID-19 has done the same thing. When you see communities where from the mid-30s to 50% of those affected are communities of color, when they have a much lower representation in the broader community, you know that you still have health inequities, both health care and health disparities that have to be addressed systematically. So one of the conversations we've been having, both as a senior management team and as a board, around, while we're doing a lot to address healthcare disparities in our communities, are we doing enough? And the fact that you see so many communities of color being impacted negatively, dying from COVID-19, and suffering significant morbidity, suggests that we need to do more here before health system and the entirety of our communities, not just the healthcare sector. So I stop there.
Okay, Wright, Lassiter, and Ridgway White, thanks very much to both of you for being here.
Thank you.
Thank you.